You know what nobody told me when I turned 65? That signing up for Medicare wrong could cost me thousands of dollars in penalties I'd be paying for the rest of my life. I'm Harold. I'm 80 years old, and in my last video, I told you about the Social Security mistakes I made that cost me over $10,000. A lot of you wrote in the comments saying you wished you'd seen that video sooner. Well, today I want to talk about something just as important and just as confusing, Medicare. Because here's the thing, most people think Medicare is automatic. You turn 65, the government sends you a card, you're done. I thought that too. I was wrong, and that mistake, combined with two others I made, ended up costing me thousands of dollars in unnecessary penalties, premiums, and out-of-pocket expenses. If you're approaching 65, or you're already on Medicare and something doesn't feel right, the next 12 minutes could save you real money. Let's get into it. Mistake number 1. Missing your enrollment window. Mistake number 1 is the one that still stings when I think about it. Missing my Medicare enrollment window. Here's what I assumed. I assumed that because I was still working at 65, still covered by my employer's health insurance, I didn't need to worry about Medicare yet. I'd sign up when I retired at 67. Simple enough, right? Wrong. What I didn't know is that Medicare has a specific enrollment window. It opens 3 months before your 65th birthday, includes your birthday month, and closes 3 months after. That's a 7-month window. Miss it, and you pay a penalty. Now, there is an exception, and this is important. If you're covered by a health plan through your own current employer, you can delay Medicare Part B without penalty. But my situation was more complicated. I had retiree insurance from a previous employer, and retiree insurance, I learned the hard way, does not count as active employer coverage, not in Medicare's eyes. So when I finally enrolled in Medicare Part B at 67, they slapped me with a 20% late enrollment penalty. That's 10% for each full 1-2 month period I was late. And here's what they don't tell you at first. That penalty doesn't go away. I paid it every single month for the rest of my life on Medicare. Over the years, that added up to well over $3,000 in extra premiums I never should have paid. 20% sounds small until you do the math over 10, 15, 20 years. My advice, the moment you turn 64 and a half, start researching your Medicare enrollment situation. Don't assume. Call Medicare directly at 1-800-MEDICARE or sit down with a licensed Medicare counselor. Most states offer free counseling through a program called SHIP, the State Health Insurance Assistance Program. They'll look at your specific situation and tell you exactly when and how to sign up. Don't let a paperwork deadline cost you thousands of dollars. Mistake number 2, choosing the wrong plan and never looking back. Mistake number 2, picking a Medicare plan once and never revisiting it. When I first enrolled, I just went with what my neighbor had. He seemed happy. The premium was low. I didn't ask a lot of questions. I signed up for a Medicare Advantage plan and figured I was set. For the first couple of years, it was fine. But then my primary doctor left the network. Then they added a prior authorization requirement for a medication I'd been taking for years. Then I had a procedure that I thought was covered, and I got a bill for $1,800 that shocked me. Here's what I didn't understand. Medicare Advantage plans are run by private insurance companies, and they can change their networks, their drug formularies, and their cost-sharing rules every single year. What was a good deal in 2010 might be a terrible deal in 2011. I also didn't understand the fundamental difference between Medicare Advantage and Original Medicare with a Medigap supplement. With Original Medicare plus a good Medigap plan, your costs are largely predictable. Your doctors, almost any doctor in the country who takes Medicare, are available to you. With Medicare Advantage, you have a network, you have referrals, you have prior authorizations, and if you get sick and need a specialist or a hospital out of network, you can face very large bills. I'm not saying Medicare Advantage is bad for healthy people with simple needs and lower incomes. It can work well. But when I got older and my health needs became more complex, I wished I had chosen differently from the start. And switching from Medicare Advantage back to original Medicare with a Medigap plan is harder than it sounds, because now I had pre-existing conditions and insurers didn't have to accept me. My challenge to you is this. Every year during open enrollment, which runs from October 15th to December 7th, actually sit down and review your plan. Look at your doctors, your medications, your expected needs for the coming year, and compare it to what else is available in your area. It takes 2 hours. It could save you thousands. Mistake number 3, not understanding what Medicare doesn't cover. Mistake number 3, and this is the one that really blindsided me, not knowing what Medicare doesn't cover. I spent years paying into the system, and I assumed that when I hit 65, I'd be taken care of. Medicare would handle my medical needs. That was the deal. Nobody told me about the gaps. Medicare does not cover dental care. I lost 3 teeth in my 70s because I kept putting off dental work, telling myself I couldn't afford it. What I didn't know is that untreated dental problems can lead to infections, heart complications, hospitalizations, all things that cost far more than the dental work would have. Medicare does not cover vision care beyond certain medical eye conditions. My glasses, my annual eye exams out of pocket, every year. Medicare does not cover hearing aids. Do you know how much hearing aids cost? A good pair can run $3,000 to $6,000 or more. I went without them for years because I didn't budget for it. And I can tell you, losing your hearing and not being able to fix it changes your life in ways that go beyond just money. And then there's long-term care. If I need to go into a nursing home, Medicare covers very limited skilled nursing care after a hospital stay. After 100 days, you're on your own. The average cost of a nursing home in this country is over $90,000 a year. Most people have no idea how to plan for that. I'm not telling you this to scare you. I'm telling you because if I had known these gaps existed, I would have made different choices. I would have kept up with my dental care. I would have budgeted for hearing aids. I would have looked into long-term care insurance when I was younger and healthier, and it was still affordable. Some Medicare Advantage plans do now include limited dental, vision, and hearing benefits that's worth checking. And there are standalone dental and vision insurance plans worth exploring. The point is, don't assume you're fully covered just because you're on Medicare. Know the gaps and plan for them. So there we have it. 3 Medicare mistakes that cost me real money and real quality of life. Missing the enrollment window and paying late penalties for life. Picking a plan once and never comparing it again, and assuming Medicare covered everything, when it absolutely does not. I made all 3 of these mistakes. I can't undo them, but you're watching this, which means you still have a chance to do it differently. Here's what I want you to do this week. Go to Medicare.gov and create an account if you don't have one. Look at your current plan. Find your local SHIP counselor. It's a free service. Use it. And if you have parents or in-laws approaching 65, sit down with them and walk through this together. Be the person who helps them avoid these mistakes. Medicare is complicated. The government doesn't exactly hand you a roadmap, but with a little homework and the right help, you can navigate it without leaving money on the table or getting stuck with bills you never saw coming. I've been talking about money a lot in these videos, and some of you might wonder why. It's simple. At my age, I know that money doesn't buy happiness, but it does buy options. It buys the hearing aid so you can hear your grandchildren laugh. It buys the dental care so you can eat a proper meal. It buys the peace of mind of knowing you're not one hospital bill away from a crisis. You've worked your whole life. You've earned these benefits. Make sure you get every dollar of them. If this helped you, share it with someone you love who needs to hear it. Leave me a comment with your questions. I read every one of them. And subscribe so you don't miss the next video. Take care of yourselves.